and kick off. So kia ora, everyone. Thank you all so much for joining us today. This is our very first partner webinar of 2026. So for those who don't know me, I am Alex Cobble-Chantren. I'm Medtech's Integrations Program Manager. And today we have with us Bart Datkowski and Parain Bradley from BPAC Clinical Solutions, which is a long-standing partner of Medtech's, whose new product CareSuite integrates with Evolution via Alex, our interoperability platform. So this is a very exciting new one, so I'm absolutely positive there are going to be lots of questions and lots of great feedback coming up throughout the webinar. As these do crop up, please feel free to pop those into the Q&A box down the very bottom of your screen. You should see that. And the BPAC team will aim to get through as many of those as possible before the end of the session today. In the event that your question is not answered in the webinar, we will ensure we get contact and question details sent through to the BPAC team following the webinar so that we make sure that those get followed up. And of course, for anybody who has any colleagues, associates, brothers, sisters, whomever, who are really, really interested in attending today, but for any reason couldn't fit it into their schedules, we are recording this session. So we are, of course, happy to pass that along to anyone interested. And it will also be available from our YouTube channel, likely early next week. So we're not here to hear me talk, so I'll hand over to who we're really here to hear from. Take it away, Bart.
Awesome. Thanks, Alex. And hi, everyone. So hi, I'm Bart. I'm the product manager here at BPAC Clinical Solutions. So I thought I'd start with a little bit of a background on BPAC. So BPAC is, as Alex mentioned, a long-standing partner of Medtech. We've been in the health space in New Zealand for over a decade, possibly two. And we are a clinically led health informatics organization. So we're wholly owned by the non-for-profit Southlink Health Education Trust. And our mission here at BPAC is very simple. It's to improve patient outcomes. We do that by building our tools for general practice and really focusing on general practice. And we aim for our tools to make your life day-to-day in the clinic easier and to support you in providing the best practice care. So many of you will hopefully already be familiar with our tools. As I mentioned, we've been working with Medtech for a long time. We've got two main product categories. So our first one is our referrals platform, and that helps you write smart referrals, high quality, clinically complete referrals within primarily the Manawataki region and the Wellington Hutt regions. We also provide a range of clinical decision support tools. So we cover conditions such as depression, chronic kidney disease, diabetes, and a whole lot more. These tools are mostly freely available to practices across New Zealand as part of our charitable mandate. And we aim to support equitable, high-quality primary care through these tools. So a little bit about CareSuite. We're very excited today to introduce CareSuite. This is the new home of the BPAC Clinical Decision Support toolset. Many of you will be familiar with our existing tool suite that you're launching from Medtech already. It'll be a combination of referrals and decision support baked into one tool. CareSuite is the new future evolution of that. And our goal here is to bring all the BPAC tools and resources into a single, easy-to-use location. CareSuite is now fully integrated with Medtech Alex and allows us to take advantage of the latest capabilities and deliver a smoother, more intuitive user experience in your PMS, which is a great improvement of the existing tool suite. This is the future of our platform. So many of you will be using our existing tools, Common Form, CKD, INR. Over the next 6 to 12 months, we're planning to migrate all the tools from that platform that they're currently on to the BPAC Decision Support platform that I've just introduced today. We're also going to be bringing new tools out to the market, and we're actually starting with an exciting new tool today. So we're asking that in preparation for this, everyone gets CareSuite enabled. We'll talk a little bit more about how to do that towards the end of the webinar. So to introduce today's tool, we're talking about the BIST, the Brain Injury Screening Tool. So a little bit of history about the BIST. A few years ago, AUT, who created the BIST assessment, went out to the market and interviewed GPs and figured out that awareness of brain injury wasn't that great. They showed that confidence in assessing and managing mild brain injuries was low and that decision-making support was needed. They did a number of interviews, they reviewed the current tools, and in response from all that feedback, they developed the BIST assessment. The BIST assessment, I'm sure a number of you are very familiar with it already and have done a number of them. They're often a requirement for certain kinds of referrals. And today's tool is a digital form of that assessment. It's meant to make the process of completing a BIST assessment a lot easier. So unfortunately, Professor Alice Theodome, who's Professor of Brain Injury Health and Director of the Brain Injury Health Research Institute from AUT, wasn't able to be here today, but she did ask me to pass on this quote on her behalf. She says, we are excited that BPAC Clinical Solutions have used their development skill and are launching the BIST so that it can be used within your patient management system or via URL, all the foundations of what we as the team at AUT originally developed. So we're very excited to launch this tool. We think it's going to be a great one. We're really hopeful that the sector as a whole finds it very useful. I'll now pass you over to Parain to run through a demonstration of the product.
Thank you, Bart. Hi, everyone. I'm Parain Bradley. I work alongside Bart at BPAC Clinical Solutions. So I'm going to run through a demonstration of the BIST tool within CareSuite. So just bear with me whilst I share the demonstration. Okay, so hopefully my screen is now shared. So I will start the video. If there's no sound coming through, just let me know, Alex. Otherwise, I will be silent while the video plays for the next 10 minutes or so. Welcome to the demo portion of the webinar. We will walk you through accessing BPAC CareSuite from Medtech and using the new brain injury screening tool. BPAC CareSuite is fully integrated into Medtech. To request access, go to caresuite.co.nz and select Get BPAC CareSuite. Fill in the onboarding request form and you'll have access very quickly once the team at Medtech have enabled this for you. Once you have received confirmation of access and your practice admin has added the CareSuite button to Alex, you can start using CareSuite. In this scenario, we have a patient who had a fall earlier in the day and has decided to visit their GP. Following a history and a relevant examination, you determine they may have concussion. First, we bring up their patient record in Medtech. Now I go to Alex Apps. In Medtech 7, it is in a separate tab. In Medtech 8, the Alex Apps button is in the Home tab. Select CareSuite, which will open CareSuite in the main window. You can see there are some modules available in CareSuite already. Existing BPAC decision support modules, e-referrals and ACC 18s will continue to be available from where they would normally be accessed. In CareSuite, the new ACC certification dashboard gives GPs access to data about their medical certification practices and allows them to compare their metrics against averages for their region. For this demonstration, we are going to walk through the brain injury screening tool. From the main page, you can see all previous pathways and assessments. A pathway can consist of one or more assessments, so you can track the recovery of the patient over time. In this case, we are going to start a new assessment in a new pathway. The BIST assessment module comprises 6 pages. The first page captures basic information about the accident, as well as information to assist with diagnosis, such as whether there are high-risk indicators and whether the patient was knocked out. If the patient has an ACC claim number, enter it here. In this case, the patient was injured today, on the same day as the consultation, so the injury occurred within the past 24 hours. If the injury occurred more than 24 hours ago, an additional set of questions relating to longer-term symptoms will appear on the next page. If you select yes for high-risk indicators, we recommend referral to the emergency department. In addition, a patient over the age of 65 will also trigger a recommended referral to the emergency department. We'll continue filling in the first page and proceed to the next one. The answers to the questions on this first page carry various weightings. These weightings, along with the symptom and impact scores on the following pages, which we will see shortly, will determine the advice given. If for some reason we need to pause the assessment at any time, we can select the Park button. This will save the assessment in its current state and allow us to resume later. The second page, Symptom Scale, and the third page, Impact Score, complete the dataset required by the tool to make a recommendation. The symptom scale captures a detailed set of data about the patient's condition as defined by the Brain Health Research Institute. We proceed to ask the patient the symptom scale questions in the order presented. There are three categories of symptoms: physical, vestibular-ocular, and cognitive. For this patient, the predominant symptoms are vestibular-ocular. The impact score, where the patient provides their overall assessment of the impact of the injury, is the final part of the assessment. As you can see, now that I have completed the first 3 pages, we have captured enough information to provide a referral recommendation. In this case, the recommendation is referral to a vestibular physiotherapist. This recommendation is based upon the predominant symptomatology being vestibular-ocular. Other possible recommendations include referral to concussion service and patient appears stable and gives follow-up advice. Now we can proceed to the Decision tab. In this case, we have determined that the patient does have a concussion. As this is the first time that we have made this determination in this pathway, a code for concussion will be written back to the PMS. In addition, a PDF of the output from the tool will be written back to the outbox and the patient record in the PMS. Finally, we decide to follow the suggestion of referring to a vestibular physiotherapist. Referring the patient will result in this pathway being closed as the patient's treatment and recovery will continue with the specialist. Now that we have verified the patient's diagnosis, we can download and print the recovery advice booklet for them to take away. Next, we provide the patient details. This information is auto-populated by the PMS, so in most cases you won't need to change anything here. Then we fill in the provider details. Again, this information will be auto-populated by the PMS. Finally, we submit the assessment. This will return us to the BIST homepage. With the assessment submitted, it will be written back to the PMS. We can view it in the outbox. If necessary, we can attach the assessment to the referral form when we refer. You can see that the assessment is marked as referred, so that pathway is now closed. However, if for some reason we need to do a follow-up assessment, we can reopen the pathway, which I will do now. The accident details are no longer editable, but we can repeat the symptom scale and impact score questions. So let's go ahead and do that. This time, we're not going to refer so that we can view recovery progress. Now we can see their progress in the open pathway. This concludes the brain injury screening tool demonstration. So I hope everyone found that useful and interesting. We were very excited to be able to share BIST and CareSuite with everybody, or some of the first people to actually see CareSuite in action outside of the building. So it was a great privilege for us to be able to show it off finally. And now I'll hand over back to Bart to wrap up.
Thanks so much, Brian. As Brian mentioned, this is the first tool we're making available in CareSuite, but it's going to be the first of many. We're very excited to bring CareSuite out, and we think it's going to have a lot of amazing things in it. It's not actually the only tool we're coming to market with. So in the next few days, you should hopefully hear about one of the other things that is coming to CareSuite, a very exciting new dashboard from the ACC that'll help you see some of the provider statistics that ACC is looking to make available to providers so that they understand a little bit better how they're assigning time off work. There'll be a lot of separate communication about that, so we won't go into too much detail. But either way, it's I guess the main point is that both of these tools are available in CareSuite. So if you'd like access to them, if you've seen the list today and you're excited and you'd like to use it, the next step is to get CareSuite. And the way that you do that is by going to our website, the one that's above me, caresuite.co.nz, and pressing the very big button that says Get BPAC CareSuite Now. Once you click that button, it'll take you through the form that Lorraine showed at the beginning of this demonstration. It's quite a short form to fill in. It's essentially just your clinic details and one or two approvals, the main approval being the one for us to connect through to the Alex API and actually render the service. After that, our team will be in touch and help install the button in your PMS, after which you'll have CareSuite available. In terms of release dates, you can go and register now. We're encouraging everyone to come through and start registering for the platform now. It'll become available in the next few days. The BIST assessment itself, the actual tool that you saw Brain demo earlier, will be available in the first week of March. So if you get the CareSuite installed, you'll probably get the ACC dashboard in the next few days. And in the first week of March, the BIST tool will become available. We'll send more communication out about that close to the time. Awesome. Any other questions, or I'll hand over back to Alex for Q&A.
Okay. So we have a couple of questions in the Q&A box. So to start, will the ACC details also auto-populate, similar to patient demographic details from the PMS? That's from Anju. I'm presuming this isn't a BIST.
Brian, I'll let you take that one.
Sure, yes. So obviously we can't show the certification dashboard at the moment because it's under wraps until it goes live very shortly. But the general idea is that it's a summary of GP certification practices. So it's not related to patients specifically. It's just at the GP level. So yes, it will auto load with your medical certification information.
Okay, and then we have one more from Deborah. She's sorry, she may have already missed the question, but if we don't have BPAC CareSuite on our Medtech Evolution, how do we organize this? That's a great question.
Absolutely. So the next step would be to go to caresuite.co.nz. We'll post the link into the chat box as well. If you click on that link, there's a big button that says Get CareSuite, and if you go through to that and you fill in the form that you'll see there, our team will be in touch with you about next steps and getting it set up.
It's worth noting, I'll just add a quick little proviso there, that you do need to have Alex activated for your Evolution. So Alex is our interoperability platform. It comes as part of your MedTech license, and most of you will already have it activated. You may already be using it for other things. But if you do wish to check, you can absolutely feel free to email us at activatealex@medtechglobal.com to check that. But essentially, that's the way through which CareSuite will be connecting. So that just needs to be set up ahead of CareSuite being enabled, but most of you will already have that ready to go. So that should be okay. But if you do wish to double check, feel free to get in touch, and I'll pop that email address up at the end. Do we have any other questions? Okay, well, the CareSuite link is popped into the chat box. If you do have any questions, please feel free to pop those in there. But I am hyper aware that, at least for me, I tend to think of questions long after I've been asked to ask them. So probably when I'm trying to go to sleep tonight, that's when I'll get about 17 questions. So if you do have any questions that arise after the fact, or if you have any colleagues who watch this after work with a glass of red and then have questions, I'm sure the BPAC team will be very, very happy to answer any of those questions. And of course, you can always reach out to us as well, and we can make sure that we get those answered for you. So I'll go ahead and plunk up our email address in case you wish to get in touch with us. I will pop that up now, and then we'll go ahead and sign off if there are no other questions that people want to see or to ask. It'd be useful if my tech was working. That would be really handy, wouldn't it?
Actually, Alex,
yeah.
I just got some feedback that potentially the video that Brain showed may not have been the highest quality. So we're more than happy to make the video walkthrough itself available separately if needed.
That would be wonderful. I'm just going to double check that everybody can see that there. Can everybody see that? Just double checking. I've got a little screen. Yeah, perfect. That thumbs up is very handy. So that's that QR code there. That takes you to Medtech's partners page, and that email address there, that activatealex@medtechglobal.com. If you have any questions about BPAC, or any of our partners, or whether or not you have Alex activated for your system, or anything, any questions you have about integrations at Medtech, please feel free to reach out to us there. We'll absolutely be happy to answer those for you. I know it's always a bit nerve-wracking to reach out to a what looks like a group email address, but I promise you we do check them. I actually get them directly to my phone, so I absolutely will be responding to those. But unless we have any other questions, please thank you all for joining us today. I really do appreciate it, and in amongst your very, very busy schedules. And thank you so much to Parain and Bart for joining us from the BPAC side. I very much appreciate it, and I think this is a really exciting thing to see go live. So we're excited that it imminently will be live. Thank you so much, everyone. We really appreciate your time.
Pleasure to be here. Thank you.